Hi, Steve Adams here, CEO and founder of Tiger Medical Institute, and I want to talk about the topic of, are supplements necessary for good health? Okay, this video is about answering this specific question. Okay, I'm going to offer some opening remarks in this video. I want to give you a traditional view toward supplementation from the traditional medical field. I want to give you the view from functional medicine, which is an alternative view, and then I'll give you my conclusion, all right? So, depending on the study that you read, I've seen studies by Harvard that say 70% of adults take supplements. The CDC says a little bit over 50%. But regardless of the source, a lot of people are supplementing, okay? So this is a really good question to wrestle with, all right? So let me first share with you the traditional view from our traditional Western medicine system, which is typically your primary care doctor, insurance-based payment. They're typically an MD or a DO. They follow what's called an allopathic model of medicine, which is to diagnose, classify something into a code, and then treat that through typically a prescription drug or surgery or some other intervention. And this is really good. This model is excellent for sick care, okay? The view that this view holds is that supplementation is not researched enough, okay? That it's no substitute for a healthy diet, that because there isn't randomized controlled studies proving it beyond a shadow of a doubt, therefore supplementation in this view is it's somewhat of a distraction from other health habits and a good diet, okay? So this view accepts nothing less than multiple controlled studies, as I said, and the problem is they don't exist. And there's a lot of problematic issues in the terms of how they're set up and trying to isolate a supplement to a set of conditions. We won't get into that, okay? But basically, I agree with some of the things that this view holds. Number one, it is not a replacement for a healthy diet. And number two, if someone supplements thinking that taking the magic pill is going to make everything better, they're wrong. You have to incorporate good diet with good health habits, and then you can have a different outcome with supplements, okay? So that's the view of the traditional view. Now, the functional view has a different view. Now, let me first define. Functional medicine means root cause medicine. Rather than waiting until someone is sick to treat them, functional doctors want to work on getting ahead of the game, preventing a problem, testing in a different way so that they can see the root cause of why a patient is progressing toward disease and then intervene ahead of time, okay? That's the model, okay? So with this approach, and this is the approach we use at Tiger Medical, if you test specifically in a way that you're looking for root cause, you can get good outcomes from supplementation, okay? Now, here's the reason why. A healthy diet is important, but it is very difficult to have one in this country because our food sources are compromised in a few ways. Number one, because of industrialized farming practices, our soils are depleted. Number two, food processing strips a lot of the nutrients out. And number three, there are environmental toxins in our food, okay? And when all of those things are present, unless one makes the choice to invest in an organic, clean, whole nutrition diet program, eating real food, they're gonna have some problems with addressing micronutrient levels that need to be supported, and therefore supplementation can be an excellent adjunct to everything else they're doing, okay? So because food is compromised, supplementation can be there to help support the weaknesses, all right? So here are the keys, all right? So here's my conclusion. Here are the keys moving forward with this. If you want supplementation to work for you, first of all, as everyone agrees, eat a good whole food organic diet, okay? I know it's expensive, but getting sick is more expensive, all right? Number 2, work with a board certified physician, whether it's a traditional model they hold or a functional model. Work with a physician and get tested, okay? And then go off the doctor's recommendations based on your testing, and then combine all of that with good health habits, okay? And when you do all of that, it synergizes and the results can be quite good. All right, so these are the things that we do at Tiger Medical Institute. All right, our doctors are functional root cause doctors. Okay, they test extensively and they customize and personalize your testing so that they get the best outcome in the results for you. And then they intentionally target those physiological imbalances that they find in your test results so that you are not wasting a penny. These supplements are targeting and supporting exactly where you need. All right. And then on top of that, we have something called our 8 Tiger Health Habits that we integrate into the coaching process with our clients so that you are in fact doing all the things that you need to do. So my conclusion is, overall, done properly with physician support and testing and targeted supplementation, supplements can be a necessary part of an overall good health transformation plan.